Hello, everybody. Thank you for joining. And then today we're going to talk about dental implants, the dangers of dental implants. We have a culture that is very much into beautiful, bright, white, shiny smiles. And from Hollywood to Main Street, there is a great focus on having these sort of American smiles that bedazzle, that are shining. But I just wanted to say some of them come at a great cost to the rest of the body. People have had root canals, people have had dental implants, people have had bridges. Going back, people have broken their teeth and had dental cavities. And so dental problems are a part of society, but how we deal with dental problems really determines how the rest of our health is. And today we'll talk about the long-term effects of dental implants. How many of you know someone who's got dental implants or have dental implants or have had experiences with dental implants? Anyone care to share their stories?
Well, I don't know if he was kind of nutty before, but he's definitely have some cognitive issues, someone I know.
Yes. So let's dive into dental implants. So in the olden days, dental problems were treated very, very barbarically, and there's some horrible pictures of kids with cavities or suppurating or infected teeth, and you just put a loop of thread around the tooth, hold it on a door and yank it, or just pull it and pull the head back. It was very barbaric. And come the 20th century, we thought we had it figured out and that we could save these teeth. The one thing you want to remember is your teeth, just like the rest of your body, are parts of your body. They're not wood, they're not inanimate, they're not furniture. Each tooth is connected to your body through dentinal tubules, which empty into a pulp chamber, which contains your nerves, your cerebrospinal fluid, your veins, and your arteries. And so your tooth is always nourished from within your body. Your tooth is always protected from within your body. And when it rots, and when you take it out and replace it with something, or you take half the tooth out and put a crown on, you're actually creating a very gangrenous condition in your mouth. You're creating a permanent pathogenic infection in your mouth. That is going to travel to the rest of your body, and that's not good for your body. We will talk about dental implants specifically today, what they are. And a dental implant is nothing but, let me move my picture, is nothing but a screw that's screwed into your jawline. When your tooth is rotten, they pull out the tooth, they look at the bone, and if the bone is also gone, they will do a bone graft, what is called a bone graft.
Oh,
yeah. So now you have multiple metals and elements in your body. So they'll take a cadaver bone or a bovine bone and stick it into your jaw and let it heal. So that once that is healed, they'll drill a hole in it, put a titanium or zirconium or stainless steel implant into it, which is like a screw. And then they put an abutment into it, which is the top that'll hold your crown. So there are 3 or 4 main parts to an implant. One is the bone, one is the implant, one is the abutment, and one is the tooth, which is ceramic-like and sits on top and looks like your regular tooth. What is the problem with this picture? For anyone who knows a little bit about immunology, you will understand that what you're doing is you're taking out a finger. It's like taking out an arm, taking out a heart, taking out a lung and replacing it with mechanical parts. In doing so, you're sticking a metallic surface deep embedded in your bone and guaranteed raising an autoimmune response to it. An autoimmune response is your body's response to any foreign object, where it says, I don't want this foreign thing in my body. I'm going to launch an attack against this. I'm going to create pus around it, and I'm going to push it out. And typically, the body is waging a war against that implant. The implant is also getting corroded. There's wear and tear. And it's not just one material that the implant is made of. As you can see, you've got to contend with bone, which is another animal or another human being, foreign material. You have to contend with metal, actually many, many metals, because it's never just titanium or steel or zirconium. It's a bunch of different things. So dissimilar metals. And the multiple metals are very important. We'll come to that in a little bit. And then there's a ceramic on top. So the dental implants, once you lose a tooth, are made of multiple parts. And we will see the effects on these on your tooth and on your body. And all these dissimilar metals and dissimilar materials generate a very inflammatory response first near your tooth. Everyone see this post I'm pointing to? Can you see the post I'm pointing to?
Yes.
That is where the titanium is corroding. When you drink a hot liquid, when you drink an acid drink, when you bite down hard, your saliva, which has enzymes in it, a lot of things can cause this implant to release particles of metal into your bone tissue, into your gums, into your oral cavity, and that causes reactions. Nearby and far away, they have found molecules of titanium within a few hours of implantation, as far away as your lungs, your liver, your kidneys, and your brain. And what happens when you get metal in your brain, metal in your organs? People see cognitive impairment. The metal, the macrophages in your immune system are trying to grab this metal, process it, excrete it, and are frequently unable to do that. And when that happens, these macrophages, instead of excreting the metal out, instead of taking the bad stuff out, become immortal in many cases. And the metal accumulates in these, and they go through your lymphatic system. Now we know that the lymph is connected to the brain as well. Used to be, scientists thought there was no great gut-brain barrier. But in 2014, a pair of scientists came up with, showed that it's very much connected. The gut is very much connected to the brain, as is the rest of the body. And these macrophages travel to the brain, dump their deposits in the brain, and what the metals cause is a poor or imperfect unfolding of proteins, and that creates amyloid plaques in your brain, Alzheimer's, Parkinson's, multiple sclerosis, all sorts of symptoms. I've had people who have had these symptoms right after, within days after a dental treatment, whether it's a root canal or an implant, and they say, ever since, never been well since this happened. And that's the reason. Now, your body, if you have a very strong immune system, may be able to deal with it somewhat for a period of time. But I guarantee you, for the longer term, it's going to have a very deleterious effect on the rest of your body. So that, say in this case, the titanium particles over time travel to distal parts of your body, embed themselves in these organs, and proceed to raise extremely inflammatory reactions in the rest of your body. And it's not just titanium, it's the bone that was at the base, it's the titanium, it's the crown materials, it's the alloys that are used to make the titanium tight or firm or whatever. And a lot of these are very toxic. There's no regulation on these materials. For some reason, the FDA seems to think that the teeth are like chairs and tables and have nothing to do with the rest of the body. They're also very poorly regulated in terms of the harm that they do. Just like the vaccine adverse events reporting system, there's a database that the CDC maintains. The FDA has handed over maintaining this report to the industry. So the fox is guarding the henhouse, so to speak. There are 3 million failed implants, and nobody knows about it. 30% of the zirconium implants actually fail, where the dentist can actually pull them out with his fingers and they come loose, but nobody tells you that. And you go through immense amounts of pain, trouble, autoimmune disease, and a loss of the quality of your life for the sake of a beautiful smile. So before you go to the dentist, you want to think about the slippery slope that is that cavity. Think hard about it, read about it before you make any decisions to poke your gums, prod your gums, insert stuff into your gums, and create autoimmunity. So these titanium implants go from this post into the surrounding bone matrix, and we'll go through the biochemistry of what happens. They go into your brain, and we'll talk about that biochemistry. There were Gardasil victims. Gardasil shots, the HPV shots, have 1,250 micrograms of aluminum per shot. And what they found was that when the patient was injected on their deltoid muscle, the macrophages, which is your immune system cells, rushed to that spot, swallowed up the aluminum salts, and they became immortal. And these people became paralyzed, they had Guillain-Barré, transverse myelitis, multiple sclerosis-like symptoms, Parkinson's-like symptoms, and they did not know why. As these macrophages traveled everywhere, wherever they traveled, it would create autoimmune responses and a great deal of inflammatory cytokine damage. Any questions? No questions. So the best therapy, guys, the best therapy in life is not to go there. It is very difficult to take titanium molecules out of your organs. It is extremely difficult to undo an implant. A lot of these implants are like those plugs you put into walls, which go in and expand. And if you were to do a de-implantation, it would destroy your jaw tissue. It's very difficult. There are symptoms, and there are lingering symptoms, and the dentists are not managing these because they are done with their job. It's over to the doctor, and it's big, big business for doctors today. There's muscle and joint pain. There's nerve pain. There are these fibromyalgic, chronic fibromyalgic symptoms where your skin seems like it's on fire. You're constantly exhausted. Sound familiar? You're constantly tired. You have neurological problems. You get lesions in your spinal cord, your brain, hand shaking, depression, skin problems, esoteric skin problems near your jaw, in faraway places, breakouts, pustules, cognitive impairment, because your brain is affected by this, multiple sclerosis. I have seen instances where people take out their implants and most of these symptoms go away if it is fast enough after the implant for them to figure out, make the connection, take it out. Lo and behold, voila, the symptoms are gone. You get Parkinson's-like trembling, symptoms of Parkinson's. Never before in my family have we had Parkinson's. This was the first generation when an aunt of mine got, she had very bad teeth, mercury in her teeth, got teeth taken out, pulled. But before that, there was a lot of dental surgery. Developed Parkinson's and died pretty much a curled up ball. And a lot of these things are due to the poisons that are very, very neurological in the materials of these implants. And what they do is this. This is what the system does. Okay, you start with steel implants and you say, whoa, this is the best thing since sliced bread. People get them, the implants fail, people get sick, the FDA pulls it off the market, and that is that. And then comes the next new thing where they say, oh, there's no effects from this. Well, there are no effects because they have not been documented yet. 10 years later, same thing happens. And lo and behold, that gets pulled off the market to be replaced by zirconium. So now the holistic alternative is zirconium. Guess what's going to happen 10 years from now? Same thing. So do some reading before you get into these things which involve injecting, embedding foreign materials into your body. And the same thing for bullets lodged in your body, shunts. When they ask you to, when they do put shunts in your body for heart disease, which have no bearing on mortality, longevity, and so on, just a foreign steel mesh in your heart vessels, which causes more inflammation, more autoimmunity, and greater mortality, all caused it. You get Parkinson's-like trembling symptoms, shaking, spasms, numbness. Tinnitus is very prominent because you got metals, you hear this ringing and hissing and buzzing, and many people have never been well since. It's in homeopathy, it's defined as NBWS, never been well since. This happened to my child, or that happened to me, ever since I got treated with steroids or antibiotics or what have you, or this procedure was done to me. There's weight loss. You eat, but you can't keep your weight on. Severe depression, inflammatory lesions on the face, mental, physical exhaustion, where many people just, 1 minute they were running marathons and the next minute they are flattened. They can't get out of bed. They don't know why. Then it's diagnosed as Lyme disease, this, that, and the other, but frequently this main issue is forgotten. Oral cancer is far more likely if you've got stuff in your mouth. Battery mouth. Anyone know what battery mouth is? Take a guess. What could battery mouth be?
The metal is actually conducting through the system, and it's electrified. And then with the 5G, this is even worse. So
Absolutely. It is a disaster waiting to happen. You have metals in your mouth, not one, but many. And when you have dissimilar metals in your mouth, you're creating a higher current and a lower current, a positive and a negative. And your saliva is a weak electrolyte. And so it acts, it galvanizes your mouth into becoming an oral battery. Then you add 5G and 4G and Wi-Fi from the top, and you have a person's mouth that's turned into an antenna. And especially women are very, very susceptible, very, very sensitive to this. Doctors tell them it's all in their heads, but women are extremely susceptible to EMF, and especially if they have dental problems, it's greatly exacerbated. And that's battery mouth. You feel metallic taste. You're literally releasing the ions from these various, mercury and gold and silver and titanium and vanadium and trumbidium and niobium and all these esoteric metals that we have never studied. We never studied these for pathology. One instance will destroy you. Sensitivity, you have inflammation, and ultimately autoimmune disease, migraines. I talked to someone just 2 days ago who said, could you give me a homeopathic for my migraines? He has right-sided migraines and severe facial neuralgia. And I happily did, repertorized her symptoms, gave her the remedies. And then I said, anything else going on over there? She said, oh yeah, I got my implant. I know it's zirconium and I got it done by a holistic doctor. And I went, holy cow, it's your
And why are
implant.
holistic doctors allowing that? Like, even the biological dentist, they recommend zirconium implants.
Pressure from the customers. Customers want that smile. Customers will not take no for an answer. And they know that if they don't go to them, they will go to somebody else. And for people who have like front teeth that are gone, they feel they have no choice, but in fact, they do have a choice. That's the time to take cognizance of your stock of your life and say, do you want a life of pain and misery, or do you want a beautiful smile? I'm sorry to say, holistic dentists tell you, yeah, go with the zirconium. 30% of those implants fail, and they don't tell you that. So there's a database, and I'll point you to it, and you can do your own looking, but it's very hidden, because when you do a Google search, up come the sponsored dental ads. The American Dental Association controls what information is fed to you. And so you have to do the thinking yourself. Nobody's going to tell you, hey, you're going to get Parkinson's from this. Nobody. They give you hope. They expunge the illness part from the internet. Try and expunge it from the memory of the internet. You have to do your own search. So anyhow, this person will feel better from the homeopathics, but the maintaining cause is not removed, so it'll come right back. This person is going to have children. She's very young. It's going to affect her fertility. It's going to affect her menstrual cycle. It's going to affect her relationship with her partner. It's going to affect what she's able to do for her children or not do. And to the extent the metals are in her mouth, we don't know whether the metals get into the eggs and are passed to the next generation. Something to think about. There are many oral cancers associated with implants. This was the 13 articles, just some basic research. If you do, you'll find 13 articles between 96 and 2009 that someone actually investigated, with 19 cases in which the osseo-integrated implant, meaning implants buried in your jawbone. So don't get bamboozled by the hard words. Look for the meaning. They're associated with oral squamous cell carcinoma, which is the skin of your oral mucosa, develops tumors. Some of them, 7 of these 19, had a prior case of cancer, which just got goosed up. It became much more malignant. It became metastatic. Oral squamous cell carcinoma, there were pre-malignant lesions, metastatic breast cancer, adenocarcinoma. There were 6 cases of cancer reported in the 5 articles that did not have a prior history of cancer at all. And cancer in another region of a body or a pre-malignant lesion. And 2 of them had patients who had no prior history whatsoever. 2 articles. 3 cases with cancer, 3 cases without cancer. So there's a lot of association, and rightfully so. You can see the reasons for the causality. A cancer is a disease of trauma, deficiencies, and toxicity. If you take away the trauma, if you take away the toxicity, if you take away the deficiencies, we have found you can heal cancer. Alrighty, as Victoria and you guys said, that is battery mouth. Let me move my picture so you can actually see the battery. And battery mouth is nothing but a battery in your mouth created by all these different metals in your mouth, which causes inexplicable nerve pain. You have these spasms, neuralgias. My aunt had severe trigeminal neuralgia, which is the facial nerves. She would literally die. And homeopathy really helped her. But man, it's not going to resolve the problem. You get a metallic taste in your mouth or a salty taste. Your mouth burns. You have insomnia. How can you sleep with that kind of pain? You can't. You could literally light up a battery in your mouth. And anyone who knows Chinese medicine will know that all the meridians, there's a node here, and the meridians, the signals, your body is run on electrical impulses. It's run quantumly, not chemically. And all these nodes are impaired because these are the nodes that travel to your breast. You see people with a root canal that leads to breast cancer, and 96% of the women who have breast cancer have root canals. I mean, that's something to think about. And when they get their dental problems resolved, that is to say, taken out, then their bodily problems resolve. So if any dentist tries to tell you, oh, there's hope, I'll fix it, think about yourself. Every person who's in dire straits, you know, if you're broke, you want the hope that someone will, you know, you're laden in debt up to your eyeballs, and someone comes and says, only 20%, I'm going to loan you $1,000. Think about it a little bit, what the consequences of that are going to be. Think about the future that you're going to take away from yourself in return for the present, and think about whether you'd want to do it or not. And the doctor is not going to help you with that decision. And neither is YouTube, because this PowerPoint guaranteed is going to be taken off of YouTube. So I'm going to post it on Rumble so I don't get dinged on YouTube for misinformation. By the way, there's PubMed sources linked for every one of these things, in case you want to check it.
I have a question,
Sure.
and you probably have this somewhere. Do you have a diagram as to what body part or meridian or whatever each tooth is connected to?
I do, and I should have had it in this PowerPoint. Damn it. I will dig it up after this, but there is a diagram that connects your teeth with all the meridians, with all the organs, and you can tell what it's connected to. In Chinese medicine, proven correct by modern techniques of electrical analysis, physical analysis has determined that we do indeed have nodes and meridians, and they inform our organs. Yes, but I don't have it in mind. Thank you, I should have. Clinical cases, there's cases of reactive lesions of the peri-implant. So this person had an implant in the front tooth, and now you have implant illness. So these are granulomas or tumors, either benign or malignant. And this was a case of pyogenic granuloma in this person. And the second one that was found was a giant cell granuloma, where you see this implant? You see this implant? That's the implant, and that's where the implant tumor is. That's where the metals come out into the jaw tissue, creating mayhem and an inflammatory storm, and you have tumors. So the thesis is the presence of metal-like particles in the tissues suggests that the etiology of the lesions might be related to the corrosion process of the metal structure. It does not take great brain power to think about this, see that you've never been well since this happened, and determine it had something to do with it. And as soon as a lot of these people took it out, it's very difficult to take it out, by the way, because the forks of the implant spread out. They got better. And Victoria just sent me the Metal Power, the Soul Life of the Planets. Oh, yes, yes. Those are books worth reading. And there are pictures on the internet you can look at for the meridian. Thank you, Victoria. Now, how does the inflammatory process work? There are two things that happen when you put a foreign object into your mouth. One is chemical corrosion. The first thing that happens is the surface of that implant, whether it's ceramic or bone or metal, corrodes. When something corrodes, it oxidizes or it lets out particles. And then the second thing is surface wear and tear. You bite down and it grinds it out. It grinds out the chemicals. So in this instance, the titanium particles travel to the bone surface. What is the bone? It is your bone tissue. Guys, the bone tissue consists of two types of cells, osteoclasts and osteoblasts. One breaks down the bone cells and one makes the bone cells. And both are critical to the life of your bone, all bones. Your bones are not made of static bones that live forever. Old bones are being ground down and broken and reabsorbed, and new bone is taking place. New bone is being formed at all times. Get this about your bones. And what you want is the right proportion of osteoclasts, which is the breakers of this bone, to the osteoblasts, which are the makers of the bone cells. Bone is not wood. Bone is not inert. Bone is not lifeless. It is innervated by nerves. You feel pain in your bones. It's innervated by nutrition. Constantly, your body is bringing calcium, phosphorus, and minerals to the bone to make it, the bone cells. So the titanium particles and any other metals really travel to the bone surface. And then the soft tissues around the jaw implant start to have inflammation. So this, we're talking about the gums. We're not talking about the bones. The gum gets inflamed, and through the soft tissue, the molecules of titanium are going to travel all over your body. You can find it within hours in the submandibular, your salivary glands, your submandibular and cervical lymph nodes, and your entire lymphatic surface. Goes into your brain, goes into your organs, and they have an affinity for soft, fatty tissue, metals too. And so these metals go and lodge themselves. It's very difficult to take them out. You would have to chelate it, you'd have to do all sorts of things, and the effects oftentimes remain for life. So the best thing you can do is not go there. When something seems too good to be true, it usually is. Okay, so this is the inflammatory effect of the titanium particles on your soft tissue. It also goes into your saliva. And so your saliva acts as a weak electrolyte, and now you have battery mouth. Permanent battery mouth. That's going to give you all the battery mouth symptoms sooner or later, large or small, depending on your immune system, how you're situated in life, etc. So in addition to soft tissue, the titanium particles also get into your bone and bone marrow, and they affect your bone. So your bone is made of osteoclasts and osteoblasts. And let's do a checkout of what these osteoclasts and osteoblasts are. We're shooting ahead of ourselves. So these are the two types of bone cells, okay? They're osteoblasts, which are osteocytes. And osteocytes are your permanent bones. Osteoblasts are your baby bone cells that grow up and become old adult bone cells. And then there are these cells called the osteoclasts, which are bone cells which take these big cells and chow them down. They put them through the food processor and recycle new bones. But they don't do that. The new bones are made inside your bone marrow from stem cells, which are called bone marrow mesenchymal stem cells, BMSCs. So they are affected by the titanium going into the bones and into the bone marrow. Because what happens now is it's creating high levels of a chemical called reactive oxygen species, which is a very oxidating, pro-inflammatory molecules that are produced inside your jawbone and inside your bone marrow and inside of the osteoblast making process. Your body brings in too many white blood cells to the spot because it thinks there is an emergency. Of course, there is an emergency. There is metal in your bone and in your tissue. And so neutrophils, which are white blood cells, come there to the site of that, what it thinks of as a pathogenic infection or a problem or an accident, and that causes a cytokine storm, meaning redness, heat, abnormal swelling, sensitivity, pus, etc. And what they're trying to do is desperately get rid of the metals. They have a high level of matrix metallopeptidases. So these are the metallothioneins. These are the enzymes in the body that mop up metals. You know, if you ingested metals, then the metallothioneins would be able to deal with it. But when it's injected, when it's embedded into your body, the immune system has a very hard time pulling the metals out. But it tries to recruit these metallopeptidases there. And what do these enzymes do? They break down the rest of your body. And all this is causing a breakdown of your matrix, where that thing was embedded. And that's the extracellular matrix outside of your implant. And so what that affects is the process of old cell resorption and new cell making. There are increased concentrations of interleukin 6 and interleukin 8, which inhibit osteoblast function. So the body is not able to make new bone cells. Think about that for a minute. You cannot make new bone cells. It's a function that carries on. It's a cycle in your bones to the day you're dead. Osteoclasts break down bone. Osteoblasts make bone. It's a dance, but it's a balance. It's a yin and yang that gets disturbed. So when that happens, bone gets absorbed and new bone never comes back. So now in that implant area, there's a ditch, there's a hole. Frequently, the thing just falls out, which is actually very healthy. So if you are so lucky as to have your implant fall out, your body has done you a huge favor. But do people listen to that? Nope. They'll go and get a deeper hole dug. So they found that after being they're co-cultured with the stem cells, that when you co-culture this metal with the stem cells or the human osteoblast, the survival rate of both the stem cells and the osteoblast decreases. So the cells that make new cells just die, and the stem cells just die. It has a terrible effect of unintended consequences that are vastly worse than the cure of your disease. The only thing you can do for losing a teeth is to improve your diet and let that tooth go, or put in a flipper, or put in, what is it, a denture, partial denture. Or let the broken tooth break out. Frequently, the pieces fall off and the base is still there, and the base will act as a spacer and keep your teeth from moving, and it'll just remineralize over the end. But the minute you put in other chemicals, other toxins, other metals, other animal bones into your mouth, you're risking your very life. I cannot tell this to a person who wants their smile back. You follow me? Even I have troubles. And people will not come to me to hear bad news. They come to me after they've developed the diseases coming from those things. What that's doing is a permanent fire, permanent inflammation in your bone, in your body, in your brain, on your skin, in your mouth, everywhere. You can't bite, you can't chew, you can't digest. You lose weight, you use vital force as that thing increases and increases. And the better your immune system is, the more it's gonna try and eject that thing. So I know that if I put anything in my mouth, I will have this reaction in a day, because I don't put stuff into my mouth. I don't put antibiotics or antibacterials or soaps or shampoos or plastics. And when I do, my body goes haywire. And you can see that in the inflammation you feel. Questions? Comments?
I have a question.
Mhm.
What type of utensils are best to use? Like, I mean, if you use metal, silverware type, you create another metal in your mouth.
Yes, yes.
What
Wood.
are wood?
For fingers or wood? I use my fingers or I use wood. I use chopsticks, a wooden spoon that goes with me all over the world. I just bring my own stuff. I cannot bear to put metal in my mouth. I
Good.
just don't like the taste.
Thank you.
Very good question. Get a spoon, invest in a wooden spoon. You will find food tastes better. And if you have any metals in your mouth, you will have sensitivity to metal.
What are your thoughts on horn spoons?
What spoons?
Horn, yeah.
Horn spoons. Yeah, that's normal animal matter. Wood is the most inert. If it doesn't bother you, by all means use horn spoons, but wood is a pretty inert thing. The thing
Also for maybe everyone already knows this, but I didn't know it until recently. You don't want to use metal when putting your honey taking your honey out. You want to use wood
yes, yes,
because it feels like
absolutely.
enzymes.
Wood
But
for everything.
what about silver? Because my understanding is that silver is health inducing, and then copper, like I use a copper spatula for
If you are short copper, that is fine. Silver is generally used as an antibiotic instead of antibiotics themselves and has great utility in bone fractures that will not heal because it prevents all bacteria from invading and it'll prevent MRSA. But in general, you want to take your metals through food. You do not want to do special things. And if you do take in metals into your mouth, your immune system is able to handle them. So
okay.
it should not be a problem.
And another MRSA related thing that maybe you already know is manuka oil is great for MRSA. So if you have like a go kit for, the hospital or whatever, you'd probably want to take that with you because it's helpful against antibiotic resistant MRSA. And I don't like antibiotics, but sometimes, if you're in like an emergency situation, that might be useful.
Absolutely. Absolutely. Honey is very antibacterial and it would be best to avoid hospitals. I cannot tell you how many people went to hospital for something benign and were admitted to ICU with MRSA. Terrible. And MRSA is only curable, guys. All these antibiotic resistant infections are only curable by homeopathy. If you have neuropathy, if you have infections that won't heal with standard antibiotics, try homeopathy. It works. I have a client with a gangrenous leg going from his knees down to his ankles. And it shrunk a lot. It shrunk way, like a few inches. He was vaccinated, vaccine injured, and almost at death's door, but he's doing better now. And the wound is healing. Kale, you mentioned a cousin of yours who had similar things with her legs, the swellings. This person has the same problem, but it's all inflammatory reactions. And these are permanent. Once a metal gets into your body, it ain't easy to take it out. The Gardasil victims in France, where the scientists did an analysis of their deltoid muscles, had permanent aggregates of aluminum in their body, and they traveled everywhere because the macrophages became immortal. They didn't know how to die, so they were these traveling buses filled with inflammatory metal oxides traveling through their bodies and lodging themselves in their brain. That's how they got paralyzed. They all had Guillain-Barré. They were in wheelchairs within months to a few years of taking the Gardasil vaccine, very high in aluminum. So there's various ways you can accumulate metals in your body. Dental implants are not the only thing. So then what happens? When the titanium, I'm using titanium as a proxy. It could be beryllium, it could be niobium, it could be a bunch of different metals which are equally toxic and we know nothing about when they're inserted into your body. So what the titanium particles induce is a release of these inflammatory macrophages. So these things, these beautiful creatures, are your body's immune system. They're protecting it. They're grabbing all the pathogens. They're trying to grab all the metal particles with these tentacles, and they'll try and mop it up, the damage. But when they come, your temperature rises. They bring a whole lot of inflammation to that spot. And if the titanium keeps coming out, keeps coming out, keeps coming out, the inflammation never goes away. So these are the classic M1 macrophages which cause inflammation. Once a acute illness is mopped up or resolved, you get another kind of macrophages called the M2, which is alternatively activated, which helps to heal that area. So your body is so brilliant, it creates a storm of inflammation because nobody likes heat. And when there's heat, all sorts of good things happen. When you have a fever, you're actually kicking your infection. It's a good thing. But you don't want to have a fever 24/7 for 10 years. That'll kill you. But what's happening here is the M1, the inflammatory macrophages are activated and the M2 are subdued. So you're forever inflamed. And especially with women with hormones and hormonal sensitivities, I find that they're permanently inflamed, they're permanently sick, they're permanently fatigued. Nobody will believe them. They think it's all in their heads, and they're literally dying from inflammation. So have faith in yourself, in your feelings, what you're going through, and take action, guys. So it's not just macrophages. The neutrophils are another white blood cells that ingest, that gobble down your toxins, and they surround your tissue and create inflammation. And so what these titanium particles are doing is they're increasing chemotaxis. Chemotaxis simply means, it's a fancy word for if there's a bad chemical in your body, it causes cellular stuff to flow, inflammation to flow around the body and move all over the place. The body thinks, hey, there's a cancer that I need to kill. So it releases tumor necrotic factor alpha, which is good if you have cancer, but it's very bad if you don't have cancer. It's just inflammation. And so all of that inflammation is killing your bone cells, basically. And so now you have a microenvironment, which is where the bone is saying, I don't want to be here. I don't want to be near this implant. And it sort of shrinks. It's like an animal shrinking, a turtle shrinking under its hood, and it's trying to spit out that implant, which is why in healthy people, implants fail with very good reason. But the dentists don't tell you implants will fail. Rightfully so. And so these are the two types of macrophages. One is, this is good for you to know because one macrophage is pro-inflammatory. The red one here is pro-inflammatory. So when you have a fever, when you have a bug in your body, this is the one that goes into action and grabs all the stuff, all the bad stuff, kills it. And when that is done, the anti-inflammatory macrophages release their anti-inflammatory molecules to quiet down the wound. This process gets inhibited or mucked up or destroyed when you have a permanent stimulus or irritating factor in your body. Any questions?
You know, I don't have a question about that, but I do want to share. Remember the picture I sent you of the remedy at the food distribution? It was called homeopathic, but it had all sorts of terrible ingredients in it. So be very careful and read carefully what you buy.
Yes, yes. So that is very true, guys. A lot of stuff that it had, I think it had dextrose corn
Corn.
syrup,
Yeah,
and all sorts of junk in it.
yeah.
So be careful what remedies you take. Don't panic. Think hard about what is happening in your body and take deep-seated action against deep-seated problems.
What do you think about DMSO for metal detox?
It is great if you want to detox metals close to the surface or even in your organs, but it is far more difficult to take because realize what the body is doing. The body is trying to hide the metals from your immune system because it knows that it's causing an inflammatory reaction. So it's going to embed them deep inside your organs, deep inside your fatty tissue, encase them, put them in macrophages. So to pull it out itself is a very deleterious process. And you see that when children are injured with mercury toxicity, aluminum toxicity from the vaccines, you try to do chelation and that kid is really hurt because these poisons come back into the bloodstream, and if they're not excreted out, so if your liver is not working, your glutathione cannot grab these toxins, guess what happens? Anyone guess?
You have an autoimmune response?
They get reabsorbed into your body in other places. So if you had a brain problem previously, you might have a lung problem next. So it has to be done very, very carefully, very carefully.
Are there other modalities that you think are good, like what, clay or
Gentle things, gentle things. So you have to do it simultaneously with the chelation, with the coffee enemas to pull out the toxins from your intestines as they get into them or excrete them out in a safe way. And you have to monitor, analyze the amount of toxins that come out of your excretory system. So your sweat, your urine, your poop will be detoxing. So when 9/11 happened, they did saunas for these firefighters and all sorts of toxic chemicals came out of their skin, salts of extraordinarily toxic chemicals, and they mopped them up without rubbing them in lest they be reabsorbed.
Yeah, I was in New
Mhm.
York during that time, and I was at ground zero a fair amount, just trying to be supportive like an idiot because it's like, oh, let's get really close to this big mess. So there was nothing really we could do to help, but we did bake a lot of cookies. But the one question I have is if you're using coffee enemas, would that mean that you would need to stop your homeopathic treatments at that point?
Not at all. But you must do coffee enemas with hyper-nourishing the body, which is juicing from the top, accompanied by coffee enemas from the bottom. And that's what the Gerson therapy is about. Juicing from the top, coffee enemas from the bottom. If you did just coffee enemas, you would die because you'd lose all your electrolytes. You'd lose your nutrition.
Okay. Thank you.
And so anything that you do to detox will help, but it has to be accompanied, number one, by hypernourishment, number one, by objective testing to make sure those toxins actually come out of your organs and out of your body. Very critical. And homeopathics assist in doing that very naturally and very normally. There is an autism protocol, chelation protocol by Andy Cutler. You may have heard of it. It's fantastic for getting the heavy metals out, but you have to wake up the child every couple of hours, 3 in the night, 4 in the night, so the entire family is losing sleep. What they found was homeopathics were far more effective because they're working with nature, with your body to get these toxins out, and the symptoms of autism greatly regressed with homeopathics, as opposed to some of the iffy protocols. But very critical, proper chelation, proper removal of the toxins, and proper taking them out of your body. Safe passage out of your body is the most critical. There's no point taking toxins out if the child is not well enough to detoxify it through its normal body processes.
So, are there any homeopathic remedies for removing the metal out?
Tons
Like
Tons.
Felicia or something. I don't know. I was just thinking.
Absolutely tons. Homeopathic remedies are thuya, silicia, alumina, depending on the symptoms. And a lot of the aluminum in particular lodges in your kidneys, extremely nephrotoxic. You're putting in the first year of life 40 to 50,000 micrograms of aluminum into a child's kidneys. The kidneys have 20% of the detoxing function of adult kidneys. Guess where this aluminum is going to go and sit? In that child's brain, liver, heart, lungs. And the kidneys are going to be toast. There was a research paper done by a woman in our University of Rochester on the effects of vaccines. They did a research paper on this on the children, and they injected these kids with all their childhood vaccines in whatever 3-4 months or several months. Now the aluminum has gotten into the body, and she was measuring the urinary aluminum outtake, the urinary aluminum that came out. And the bizarre and retarded research of this person looking at the toxicity of vaccines was initially aluminum came in tiny drabs, and then later on there was no aluminum in the urine of this child who was injected with 30, 40, 50,000 micrograms of aluminum in the first year of life. And you know what the researchers said? There's no problem because no aluminum came out of the body. The child's kidneys do not work. They stop functioning loaded with that kind of toxicity. And instead of looking for aluminum in the organs, she just determined the urine didn't come out with aluminum in it, and so there was no problem. That's the kind of research that is being paid for by pharmaceuticals, guys. Their mouths are band-aided. But you can do a lot with homeopathy, a lot. You should read The Impossible Cure by Amy Lansky, whose child developed symptoms of autism at the age of 1 or 2 or something. She gave, his first remedy was carcinosin, and within days, the child developed speech. The child started looking people in the eye, and Max is now a 30, 35-year-old who holds down a job and the autism label was removed from him, and he's a regular kid now, regular young man. But she did all this stuff in her child's childhood. It destroyed their life, their family life. Many families are destroyed by this sort of the strife oftentimes between parents with different views. And so imagine a mother with 20 mercury amalgams in her mouth. Then she takes the DPT in her pregnancy. Then they make her take the Hep B in her pregnancy. So now she's got mercury, she takes flu shots, which have mercury in them. She's got mercury, aluminum, and the child is exposed to 250 times the safe EPA level for mercury and aluminum while it is still in the mother's womb. It comes out of the mother's womb messed up, low birth weight, barely thriving. On the first day of life, it gets Hep B and vitamin K shots, not oral, but shots which contain 100, 150 micrograms of aluminum. The child, and if the child is a preemie, it doesn't have a chance in hell. Between the preemie shot, they give them shots so they almost stop breathing. They're giving them cortisol, they're giving them, pumping them full of antibiotics, they're giving them these vaccines at birth. We have children who had APGAR scores of 9 and 10 die in our preemie units and at birth. The US has one of the highest fetal mortality rate, miscarriage rate, and maternal mortality rate of all developed countries in the world. And you know how much we spent on medical? 20% of our GDP spent on medical. And mercifully, I will post this on Rumble, so you'll be able to see it later. Alrighty. So osteoblasts get curtailed by the metals, and osteocytes get destroyed, don't develop. and your osteoclasts eat up your bone cells at that inflammatory point. And that happens with implants. That happens not just with dental implants. It can happen with heart valves. It can happen with stents. It can happen with bullets lodged into your body during the Second World War. It can happen with rods you got from fractures, permanent rods in your body. All of these things cause autoimmunity that you need to be aware of. And it's guaranteed. It's not if or when. It happens in different forms and in different levels in different people. Any questions? No questions. This is just a nice picture of neutrophils to say the same thing, which is the inflammatory macrophages are activated, the neutrophils are activated, the tumor necrotic factors are activated, and your bone gets destroyed. And there's more, because I spoke about titanium. So the way research happens is they put in titanium and people are going to say, oh, shoot, I got it and I was very sick. And then that forces grants and research is done and they say, oh no, titanium is very bad. But it's not just titanium in the implants. It's made in China, cheap Chinese crap. There's no regulation. They put in every kind of metal, dangerous, non-dangerous, radioactive, not. We have no idea what's going into these implants because they're not heavily regulated by the FDA. Because the FDA thinks of teeth as furniture. They're not part of the body. This is what dental implants of titanium contain. They contain Al, that's aluminum, vanadium, niobium, iron, zirconium, tantalum, metals you've never heard of before. The stainless steel implants contain cobalt, chromium, vitalium, molybdenum, gold, just all sorts of metals that are creating antenna. The more dental problems you have, the more you're going to be sensitive to 5G, 4G, and all that, because you are an antenna. Your lungs are an antenna. Your brain's an antenna. It's got all this stuff in it. So really, to detox from this, you would have to remove the implant. You'd have to chelate out the heavy metals, which is a very difficult task and would take a long, long time. You would have to hyper-nourish your body from the top in order to give your body the support it needs. And that's why we go with diets that are flesh diet, animal fat diet, because you replace flesh with flesh, fat with animal fat, your fat with animal fat. And that's the easiest thing for people to heal with and from. And what do we have in the world today? Vegan diets that do the opposite. So now all these vegan ladies have destroyed their teeth because they didn't get enough fat soluble vitamins. They've got implants because they want it to look beautiful, and rightfully so. And now there's metal toxicity, and glutathione is an animal compound. You can't even remove any of that. And they're having children. Children come out with crumbled teeth, literally failure to thrive. And it's a tragedy. It's a tragedy that is very avoided by giving traditional nourishing diet and removing the toxicity in the mom. And eating meats and fats. So people with multiple sclerosis-like symptoms, Parkinson's-like symptoms, autoimmunity, I would highly recommend eating as raw as possible of meat and animal fats so you understand the reason why you're doing it. To reduce the autoimmunity, to help you detoxify. And then as time goes by, your gut is healed, your toxins are more removed, you can add other foods, but let your body be your guide. Questions? No questions. Yeah. Okay, and then ceramics, the stuff that your crown is made from contains aluminum oxide, polycrystalline alumina or aluminum in another form, hydroxyapatite, beta tricalcium phosphate, carbon in different forms, zirconium toughened with aluminum, plastics, sometimes there's plastics. Tons and tons of mystery chemicals, of which we know nothing, that are embedded in your living tissue. They contain contaminants. This doesn't even go into contaminants. What they find in a lot of vitamins and supplements is they put in 3 different things, but what comes out contains a lot of nickel, cadmium, because the manufacturing process causes the contaminants. Same thing with vaccines. They contain a lot of, they put in aluminum, but they come out with a lot more aluminum because the manufacturing process has contaminants, and they don't test for those. You can go after the fact and test a vaccine, and you'll find that it contains way more than 250 micrograms of aluminum. Why? Because of the manufacturing process. And they're not regulated. There's minimal regulation. Nobody makes this stuff in the US. It's all made in China. They are testing it on you and me. The injury database is not managed by the FDA. They're relying on the companies to put it into a spreadsheet all the failed implants, and they're washing their hands of it. You know what it's creating? A massive industry for the other doctors. We now have a disease called fibromyalgia. We have a disease called Parkinson's. We have multiple. We did not have this. There's 100 diseases with esoteric names that could all fall into the category of dental implant toxicity, or root canal toxicity, or implant toxicity. There are breast implants too. People put implants in their breasts. Any questions? Polymers, I can't even pronounce that. Polymethyl methacrylate, PMMA. Polytetrafluoroethylene. All I know is fluorine is highly poisonous. Polyethylene glycol, highly poisonous inside your body. Polyurethane. The layers, the cover of the tooth is made from a lot of plastics that corrode and decompose over time. Bad news.
I have a question. If they do fail, then are the teeth still able to regenerate if you support them after the, say you've had a polymer fall out, which might be a good blessing. Or is the tissue just dead after being capped with that garbage?
As long as you're alive, as long as your immune system is alive and you nourish it, miracles can happen. In
Okay.
other words, that can fill up, it can remineralize, wonderful things can happen. There are just some changes that are so organic, like if they did an implant and it failed and they ripped another hole in your jaw, sometimes it's hard to heal, but the body heals. The body is a healing machine.
Well, I wasn't referring actually to the implants, but to, so I had my amalgams replaced with so-called healthy stuff that's, polymers basically.
Mhm.
And so I had some of them fail. I also had an insane dentist who decided to basically like put icing all over my teeth. He didn't even shape them. It looked like, a mad cake pastry chef that decorated my teeth with ghoulish drops. It was the strangest thing. And then I spent a year trying to get that remedied.
Mhm.
And he was a well-known, he passed away recently, but he was a well-known Marin dentist. And I just that's where, you have to really be careful with the holistic dentists as well. And they are often just sort of a rebranding of the same nonsense. So
it's the same nonsense multiplied 5 times in cost for the same outcome. Any biological dentist that does not walk you through this PowerPoint is not telling you the truth. They're giving you false hope.
So I have a story that I just learned about yesterday. I was talking with this gentleman who is a skier, and he was in a skiing accident and separated three of his the tendons in his shoulder.
Mhm.
And they wanted to do metal, surgery, implanting metal to connect them. And he refused. They said, "Oh, you're going to be sorry. It's never going to connect." But it did. And it connected perfectly. And it's great. And I mean, it seems like what you're presenting could work for hip replacement, knee replacement, shoulder, all those metals that are used in our bodies to replace parts.
Absolutely. Absolutely.
I mean, it's the same thing, no matter it's in the mouth. I mean, there isn't the saliva in your, shoulder joint, but,
Same thing, same inflammatory response.
yeah.
So true, so true. And people forget, they want instant solutions, but they forget the body is incredibly capable of healing. If you, I've seen with DEXA scans, osteoporotic 80-year-old person get increased bone density by 25% in 4 months of raw milk. That's amazing. Amazing to witness. If you give the body the right foods, it will heal, and very fast. All righty. Anything else anyone got to say?
Well, plus they were saying that if someone has had the COVID shot and they have metal in their body, with knee replacements, hip replacements, so on, that it's much more dangerous.
Yeah, it'll exacerbate every illness, every form of autoimmunity you have, every cancer.
Yeah.
Very much so. I have a friend, a very dear friend, who used homeopathy with her kids all her life. And during COVID, the last 3 or 4 years, I was really not that much in touch with her because I was so busy with my daughter's emergency. Now I feel terrible. Her family, she was even retired. Her family coerced her into getting the jab. And she's gotten COVID, long COVID, and now she's sick again. And her cognition is completely gone. She can't remember the thing you tell her an hour before. And I said, "Oh, it's just menopause." And then she told me she took the COVID jab. And I said, "Oh, shoot."
Ooh.
Yeah. The cognitive impairment is horrifying from the jabs. All righty. So
I
nothing
have a
good without
question.
what?
I have a question. The
Sure.
previous slide, it showed the metals. One was
Appetite.
hydroxyapatite. Yeah. So that's also bad.
Well, it has got hydrogen, a calcium, phosphorus, and an OH ion. So it's good to brush your teeth with it because it's got all the ions you need to mineralize. But you don't want to inject or embed any of these things into your body in a place where they're forced upon your bone tissue.
Okay. And another thing is, suppose if uh, I know now this is it becomes difficult, like when you go to the dentist, and then again there is no difference between conventional and biological dentist. That's what I'm learning now. But then someone who has got crowding of teeth,
Mhm.
what do they do then? Like, I mean, what can be done so that, and like, and still in a growing stage, once you go to the dentist, they just tell you, their procedure, and you get, I mean, somehow you get convinced, okay, that would go bad, and then you'll have to remove teeth or something. Now, even removing teeth is a issue because of those meridians.
Yes, yes.
Yeah, right. So I'm so confused, like, because I have a lot of tooth extracted,
That is
and
absolutely the wrong thing to do. You want to expand your palate. So palate expansion means putting a palate expander in your mouth at night and increasing your dental arch diameter or circumference in order to accommodate the teeth. And that's what Vestine Price did. And talk to Sunshine. Sunshine, talk about the palate expansion you guys did with your child.
Yeah, my daughter went to this dentist, White Jenny, and she did that thing where she wore a what do you call
Palate expander.
appliance. She wore an appliance that allowed her jaw to expand, but also expanding the jaw allowed the teeth to come all the way in. Otherwise, the
Mm.
teeth don't come all the way in. They, they're just partially in. And she has a beautiful, beautiful set of teeth now. And I mean, she just did not want, we went to another dentist who wanted to pull 4 of her teeth. And she just cried and said, no, 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 I won't do it. And so we found this dentist, Dwight Jennings, who's in the East Bay in Alameda. And he, you can see him and he works with that.
So
And
what
this was done
Sunshine?
at what age?
Well, I can't, she was probably in her early teens.
Mm-hmm. Okay.
What Sunshine is not saying here is she listened to her daughter. The daughter had intuition.
Yes.
Nobody knew what the hell the solution was, but they went with the least injurious solution. A palate expansion costs like a few bucks, whereas removing the wisdom teeth or all that is very expensive. And so a person might want quick results, the dentist might want quick revenue, but it's very rare for a parent to listen to their child and for a child to have that intuition. That's the remarkable thing about
Okay. So that expander, the child is supposed to put it all the time.
Yes, at night.
Yeah. Okay. Okay.
At night.
Okay. Thank
How
you.
long,
Thank you.
Sunshine? How long?
I don't remember, but she still, once it expanded and the teeth were all the way in, she still wore it to help stabilize the, and I don't think she wears it anymore.
Because my daughter has those shark teeth
Oh, yes. Oh, yes.
and I don't see them coming down. But she's not complaining of anything.
Yes.
Now, my issue is like if she's not complaining, I
Exactly.
thought they will come down. But I don't know if I take her to the, because I recently I was at for the dental thing. And I just happened to tell my dentist, and she's like, okay, get her in. Has she visited? I said, no, no, she hasn't seen dentist for a very long time because my sister is also a dentist.
Oh, God.
And yeah, but then for my daughter, she has not done anything because she was so small when we used to visit her. And then I'm like, today only I saw it in the evening, those 2 teeth, and I'm thinking there is a little, it's discolored actually. And she doesn't show me, and then she says it doesn't trouble me. So why do you get so worried, So I don't know what's happening, whether they're going to fall off on their own or they would find their place where to go. That's why I was just asking about that.
The key to explore is palate expansion. And if it's not troubling, don't worry about it. It'll make her give her a quirky smile. Many people with shark teeth look, all the Moshimi Chatterjee, and they look beautiful, and they stand out. And if they want to fall out, they will. If they're giving trouble later, you can think about it. But if it's not a problem, don't make it a problem.
Because it's not outside actually, it's like inside, in the palate, behind the tooth. So maybe it doesn't bother her also. It's only you see when she looks up and you can look at, at the palate.
You should do the palate expansion as soon as possible while she's still growing, while her jaw is
Yeah.
still.
Yeah, okay. I'll have to check that, yes. Thank you,
Even
Sunshine.
if you have to go to another country to do it, it's worth doing it because the mouth and jaw is so important to a person's.
Right.
Look up Dwight Jennings because he's written several articles. He's spoken at conferences, and
Okay. It's W. Wyke Jennings.
Dwight, DWIGHT, Dwight.
DW the white.
Okay, okay, okay.
All right.
Oh, okay, thank you.
Is there a chart for the canine meridians? Because when my dog was a puppy, she had to have 2 teeth, her 2 front grooming teeth removed because a Westie slammed into her and knocked the teeth through the roof of her mouth. And I'm curious if that may be affecting her health now, and if I can kind of use that as a guidepost for supporting her.
Absolutely. Any Chinese medicine practice has a tooth meridian chart. Consult it, and you can support and heal those organs.
Okay, great. Thank you.
Great idea. I should have had that. The two of you mentioned it. But it's easy enough to find. Okay, and now nothing is complete without actual experiences of people. This is actually from a Weston A. Price forum, so people have actually had these experiences, and it is so important that I'm going to read it to you. This is a guy, I write this to share my experience. I had 2 titanium implants placed and have had non-stop problems. From the beginning, one of the 2 implants fractured while being set. After much research, I came to the conclusion that the dentist doing the work did not use a new burr. A burr is a drill, sort of a drill, when drilling for the implant, and used burr's smaller diameter hole. Maybe he did a smaller diameter hole. Might be why it was so hard. So he's making excuses. So hard to turn the implant into the hole drill. Going in to have the fractured implant removed was nothing short of the worst experience I've had in a dentist chair. There's a reason your children start weeping in the parking lot of a dentist. It's not the right place for them. Raw milk is the right spot to start. For 2 weeks after practically nonstop headaches, told we need to wait 4 to 6 months to heal, and then another implant could be set. As you can imagine, so in the meantime, he's in torture for 4 to 6 months. As you can imagine, I was hesitant to go through the procedure again. I was assured all would be fine, and so I healed and was told the second implant could be set again. The implant was placed without any difficulty, and I was thinking all would be fine. It was not long after this that I started having joint soreness. It's traveling, guys. The pathogens and the metals are traveling to your distal parts, specifically in my shoulders and back, closer to the teeth. Not so much time went by, then my back went out like never before. When you have esoteric problems that you can't explain right after a procedure, suspect the procedure. I was in so much pain I could not move without spasms. I still had not connected the dots as to the connection of the implants. Most people don't. I worked through the back problem with the help of a chiro. So let me just say this, a chiro will not fix a maintaining cause. Homeopathy won't fix a maintaining cause. Diet will not fix a maintaining cause. Antibiotics and surgery will not fix a maintaining cause. You gotta get rid of the maintaining cause. Back to his story. I still have shoulder soreness. Time passes to the point of setting the abutments and setting the crowns. Then what happened? Continued. I go in to have this work done, and while resetting a healing cap, what is that? The heading cap or healing cap, I get an infection and I'm put on a round of amoxicillin. Amoxicillin is the drug that wipes out your intestinal bacteria and makes you schizoid. Of amoxicillin, which clears the infection until I stop taking it. The infection starts right back because the infection is deep in the bone. At this point, the dentist puts me on clindamycin, another antibiotic. This clears the infection, but within about 6 days on this, I feel totally out of sorts, as would I. I get online and research this antibiotic and find so many incredibly bad reports on this drug. And you know, the dentists are willy-nilly deploying these drugs. They're not doctors. They don't see the gastric effects or the other effects of this. The dentists, as long as the inflammation disappears, they don't care about the rest of the body. So anyhow, he took the clindamycin. I get online and research this antibiotic and find so many incredibly bad reports on this drug that I stopped taking it immediately. The infection is gone, but now the headaches start and my digestion has been totally screwed up since then. Now, 5 weeks later, even while taking the best probiotics I can find. Okay, what else could go wrong? Well, within 5 weeks after the crowns have been set, I still have headaches and I have serious tooth sensitivity on one of the implants. Also, I felt a constriction in the back of my throat and a tingling sensation on my tongue. What is that, guys? Hint? What's going on here? Any guesses? Tingling sensation on the tongue. He's got battery mouth.
Like battery, yeah, yeah.
He's got battery mouth. Once again, I researched the possible reason for the newest issues and come to find out that the lithium disilicate material used for the crowns have a known adverse effects in some, if not all, people. You drink hot food, eat acid things, chomp down hard, you're going to get battery mouth. Now, something I have not mentioned until now is that I have a gold bridge and 2 gold crowns also in my mouth. And I have tried to talk to the dentist about oral galvanism as a possible reason for some, if not all, of those problems. Mercifully, his dentist acknowledges the possibility, but does not seem to think it's the problem. Why does he not think that might be the problem? Because he doesn't want to. I still get headaches. I still have joint soreness. I don't sleep well. I still get a constricted feeling in the back of my throat. My digestion is not right. To be clear, it's actually gone to pot. I'm at the point that I know that the implants have to come out. The only reason I haven't done it sooner is the constant assurance of the 2 dentists working on me that it would be all good in time. Well, the time's up. If you're reading this and are considering titanium implants, be very careful and consider all the options, because I wish I had. So if someone tells you a story that's too good to be true, it probably is. I want to tell you the story of my Richard, who broke his tooth recently, chomping down on a cherry pit. He was so hard. Guys cannot stand pain. They get horrified. He was very horrified. He's going, ow, 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 rush to the dentist. And the dentist said, yep, the tooth is cracked. It was bondoed before. And so let's get it out and let's put an implant in it. That's the only solution. And I go, whoa, whoa, whoa. Before you do that, think about all the things that could go wrong. He was in no frame of mind to hear, because the freak out, the pain, the fear, and the dentist's calm word. What the dentists do is they'll do one thing at a time. They'll say, oh yeah, I can help to get it out. Next step is they'll say a flipper, but a flipper comes out. Then, or you can do a bridge, but then I'm going to destroy the 2 side teeth, and you already got your wisdom teeth out. You're already down to 28 teeth, and now 27, and then it'll be 25. How will you bite? And so they talk you into an implant, and this person who has no implants and no root canals, all of a sudden, who is my partner, is going to develop these symptoms that essentially all of us will have to deal with. And I cannot tell you what kind of arguments and fights we had, because he took the COVID vaccine because he was pressured by family and friends. And that had deleterious effects on him that he doesn't even know about. And now the same person thinks what I'm saying is woo, and what the others are telling him is what he should do. And so it's very hard to deal with family members who have this problem, who are panicked. They're rightfully panicked because a tooth is a big deal. You feel it every single time you bite down. And so after many arguments, many debates, outright fights, he's finally let off. And I said, look, I have this, my tooth fell off. I did nothing. It got infected a little bit. I chewed on garlic, little pieces fell off, and now I have a spacer that's not made of cow bone. It's not made of an implant. It's my own body, and it's mineralized over. It may not look great. Here, somewhere here. It may look ugly, but who cares? I don't have fibromyalgia. I don't have cancer, oral cancer. And these are the things you're looking at. The problem is all this data is right there, but people don't put two and two together, and the doctors get them at a point of panic when they're panicking. So my recommendation to you guys is please don't panic. Bad stuff happens to everybody. You break your teeth, you get cancer, you fall down and injure yourself. Let the pain flow through you. That's your body's way of telling you to be quiet, calm down, and then you take stock and see what is actually good, not for my tooth, but for the rest of my body. So far, he's backed off from doing it. Mercifully, in the last week, a chunk of the tooth fell off. He's not in so much pain. He's making soft foods. But you never know. He might go and get it, and he will have a dreadful rest of his life. I guarantee this, if he has an implant. And the thing is, it's not, you don't correlate it to what you did. You are 65 and the doctor, oh, you're old. Of course, your mother had fibromyalgia. Of course, you're going to have your family history of this and that. Well, guess what? They all had implants. They all had root canals. They all had mercury and vaccines, toxicity. It's epigenetic, folks. It's not genetic. All right. Next one. Any questions so far?
And I have a comment because I have a root canal that I've had for probably at least almost 20 years. And when I went to my wonderful doctor who helped save my life when my heart issue, came about, when I said, I've got a root canal and, should I have it removed? Do you see it as a problem? He said, I don't see it as a problem for you. And so I never did anything more with it. I'm not sure I never asked him what he based it on, and he left the area. So
based on the research that I presented so far, do you think it is benign?
I tend to think what you're saying is more the truth, but I don't know, since I've had it so very long, and I don't really know what it's in my life, and
and that's what most people think and feel, and because you do not correlate chronic problems to a dental issue. Next example. Anyone else have any comments? All righty, let's go to the next example. This is another person on the forum who says, I have a titanium dental implant. I have had a titanium dental implant 2 weeks ago, been on antibiotics for 1 week. It was an extraction of previous crude retained crown, an implant placed in the same. So the first implant failed. There was also bovine bone graft placed. So now he's got foreign bone, metal, ceramic, the works. Then I was told to wait 4 months for the porcelain crown to be placed after the graft. That same day, I started noticing some tingle on the lips. However, it was on the opposite side of the face. The dentist told me there was no nerve touched, so apparently it was not paresthesia. So the dentists don't learn immunology. They don't somehow seem to realize the whole body is connected. If you have neuralgia on the opposite side, the day after you had your dental procedure, it is very likely the cause of it. Occam's razor, that's simple logic. But not the dentist. Something else I noticed is a metal taste coming directly from the implant. What is this, guys? You should be able to tell. Anyone take a guess? Metal taste coming from the implant?
The battery mouth.
Battery. He's got battery mouth. It's like I literally having a 9-volt battery in the mouth. Some days after the implant, I also started noticing some tremors on the fingers and some muscle contractions in the arms. Although the lip tingle is still there, it is not as strong as before. Many times people find that on the same side of their body as they had the procedure, there's all this numbness, tingling, neuralgia, fingers, legs, and so on. Pay attention to this. I'm now probably going to see the dentist again, and I'm personally considering pulling out the implants. Smart person. I feel like something is not right. You should trust your intuition. Looking on the internet, but being no specialist myself, I suspect either oral galvanism or some kind of autoimmune response to the metals of the implant. And he's spot on. I have read that no implant in the world is 100% titanium. He's absolutely correct. And that they always contain other metals. The law of dissimilar metals will cause oral galvanism. Depending on the metal, the system can reject it or show some allergy. Have you had any similar case, or do you have any experience like this? I already have a titanium dental implant for many years without any issues, but after investigating, I realized it's from another brand. Apparently, the other implant is better quality than this one. So here begin the problems. And then someone else responds, sounds like what's happening to my buddy. Are you any better? My buddy, his guy's talking about his friend. He can't work, really run down, lost weight, ears are ringing, weird food allergies. So all of these things, I help people with homeopathy, but they're temporary measures, folks. The maintaining cause is the maintaining cause. Was super sports and cycle guy before, and now he's like a ghost. I've seen this happen to many, many people. Looking online to try to figure out, we found tons of white smiles and no bad news anywhere. Only Dick Van Dyke is talking. Something's hinky. Then a commentator said to Google www.docseducation.com/blog/millions of bad dental implants surface secret FDA database. So he's taking a look at that. You should too. Looks like 10 million bad reports, 3 million implant complaints, no information available, and about 3 million implants happen every year. So there's lots of implants that are failing. 30% of the zirconiums are failing, but you will find no information on that anywhere. And each report by a company, they could actually put in 100 reports in a spreadsheet, and it would be counted as one. So the false, fraudulent data, not managed by the FDA at all. Counting is wrong. 3 million dental implants complaints, but no info available on the FDA mod search. It's not just an allergy or a reaction to one metal in dental implants. There are lots of metal allergies because lots of people are sensitive to nickel, and that's in almost all dental titanium, but docs are not required to tell you. In fact, they don't know themselves. They get this stuff from China and pop it into their mouth and away they go, because it's a multi-billion-dollar industry. And they play to your fear, your pain, your vanity, which is literally what I see happening in Richard every day. So we will see what happens, how he feels. But so far, he's managed to overcome the temptation to get it yanked out. We'll see what happens. Okay, this is zirconium implant. So what is the holistic dentist's reaction to the titanium? Hey, screw that dentist. I've got the real deal for you that'll work great for you and is holistic. That'll be 20 times or 10 times the cost of this one. And I will hold your hand. I'll put in oxygen and this and that. Well, this is the person. 2 years ago, I had molars and my teeth replaced on each side. Having read about the potential negative effects of titanium and having an autoimmune disease already, I decided to go with zirconium implants. Now this person's going holistic. After augmenting the bone depth of my upper jaw and inserting them, that means bovine or bone from some other part of their body. So a horrifying procedure. Because the bone erodes. Why does the bone erode? Because of the inflammation from the previous insert, whatever it was. I let it heal for 9 months before having crowns put on. You'd think by 9 months you would know that there's something dangerous about this process, but I guess people believe their dentist. So I let it heal for 9 months before crowns put on. Only 3 months later, I started to have pain in my sinuses. And shortly after that, the implant started wiggling. Thankfully, his immune system is great. Half a year later, the oral surgeon was able to just rip them out with his bare fingers. They hadn't grown in. The bone and the implants and such had all been rejected by the body. He then told me that about 30% of his patients with zirconium implant in their back upper jaw have failed implants on their first try. Did the dentist ever tell you that? Nope. Well, this dentist hadn't told him that before either. What now? The dentist offered a redo of the implants for free and suggested that titanium has a higher chance of staying. Now we're going back to the old thing. Bridges are no alternative since the 4 teeth surrounding the gaps are healthy. Thank heavens this person has seen the light. I feel great without any replacements now. So this person is feeling great without replacements, but the dentists are warning him that the surrounding teeth will move. And boy, is that a problem. Worse than autoimmune disease. I'd be interested in hearing if anybody has a similar experience and if there are any alternatives I haven't been told about. What is the best alternative in your opinion? Any opinions?
Don't do anything.
Exactly. Guys, if it ain't broke, don't fix it. I mean, it's broken, but don't fix it with fake stuff.
Sushama,
Mm-hmm.
I'm studying the electrical healing, so that may be an alternative.
Yes, yes, yes. The problem is if you have dissimilar metals in your mouth, you're going to have a battery in your mouth. And getting rid of that literally involves looking at every micro mineral element in there and trying to fix a problem that is extremely complex and difficult to fix. So here is the this is why dentists have gotten so rich. First, it's the diet, refined flours, refined sugars, seed oils. You get a cavity or the child gets a cavity. You fill it up. Pretty soon the cavity grows bigger. It reaches down into the pulp chamber. So the cavity is a few $100. The fillings are a few $100. They fall out, more fillings for a few $100. Then they say, okay, now it's too late to do anything to the tooth. We got to put a crown on it. So now you're actually clamping down on the infection because the tooth might be rotten and you're putting a cap crown on top. It's like you have an infection and you cover it up with Band-Aid. So then everything rots and you got a root canal. So now you get the root canal done and the root canal fails because there's pus all around it and it just didn't take. Then the dentist sells you an implant. They say, oh, I'm not just gonna put a root canal, a post in your dead tooth. I'm gonna put a post in your jawbone. And so by the time you're done with all this, you've spent thousands and thousands and thousands of dollars, literally thousands of dollars. Used to be about $7,000. It's probably more like $50,000 by now. But that is not the real cost of an implant. The real cost of the implant is the cancers you get, the Parkinson's, your paralysis, your inability to get out of bed, your chiros and osteos and surgeries and chemo and radiation. And so it's a slippery slope. If you take this trip, it's a slippery slope. The simplest fix to a cavity, folks, is diet, consisting of raw milk, as raw as possible meats, animal fat-soluble vitamins, diet rich in minerals, green vegetables and such, but they are slathered in animal fats, which are rich and fat-soluble vitamins to help you metabolize the minerals. So if you get a cavity, if my grandson got a cavity, which he does because his dad during his custodial visits feeds him French fries and juices, the fix is not a filling, but rather a change in diet. Parents have to work together to make sure the diet is good. Homeopathics, which will keep the tooth for as long as possible until it is no more possible, the tooth hollows out and falls off. But that can mean many, many, many years before that happens. And so you just carry on with the tooth. Let your immune system deal with the tooth with the aid of the diet. And this seems very simplistic, and it seems very, a dentist would laugh at it. They would say, hey, that's not the right, but that's how the body heals. And that is the final, the ultimate, the best, the least damaging kind of healing you could have. You give cell salts. There's lots of cell salts that help you imbibe the minerals. If there is a tooth that gets pulled out, like you bite on a pit, cherry pit, like Richard did, you can put in a flipper, but I have a recommendation that you just let it be. Let the tooth fall off. Don't panic. Don't fret. Don't freak out. Go consult a dentist, but read this other stuff, which is not easily available on Google searches, unfortunately, now anymore, but you can find it. And the way to find answers to such questions is to question yourself. If you're desperately wanting an implant, Google implants bad. Implants destroyed my health. Implants are toxic. And the non-sponsored ads might come up. You might get a hint or two as to what some of the problems might be. So when you are faced with a problem, your attitude of seeking a different answer is very important in the face of hopefulness. When you're in pain or when you have cancer, you want to believe that the chemo and the radiation will work. That's what you're after, and it makes you feel good. But that's where your objective mind and your truly protective soul and spirit needs to come into being, like young Mirabai did. She didn't know jack about implants and root canals and this and that, and she just didn't want her teeth taken out. And parents respected that. And that's where you get in touch with your whole body and say, hey, is this good for me or is this bad? And so with my tooth, example of my tooth, I broke it on some food in the farmer's market. It hurt like hell. I took it to the dentist. The dentist said the same things, take it out and put an implant. I didn't go to the dentist after I thanked them for that information. Over the next 6 months, pieces of the tooth fell off. I ate soft foods. I was careful. I remineralized. And now I have a base. So my teeth have not moved. The base is made from my own bodily material, so I don't have an autoimmune reaction to it. I can sleep at night. I don't have fibromyalgia. I don't have oral cancers. And I'm living with it. And yeah, I don't have a tooth, but so what? So what? I have 31 other teeth. There's no damage to the body, and you kind of learn to live with it. Are there any questions? Or should I stop sharing and we can do a discussion offline? No questions? I'm going to stop sharing. Thanks, everybody, and we'll have a discussion offline. Thank you very much. And I'm going to stop recording.